Good morning, I'm Dr. Kammerer. I'm the Chief Quality Officer at Mosaic. Today I'd like to discuss with you the state of COVID inside of Mosaic's service area and surrounding areas. Today we feel we have an unprecedented increase in a number of our cases as they've gone up substantially with the reopening of schools, the reopening of universities, and the gatherings that we've started to have again. Although these reopenings have been a blessing in alleviating some of the stress that has occurred with COVID, they've also shown an increase in our number of cases. As such, our number of cases have increased substantially and we're starting to notice a trend. This concerns us as we move forward. Typically in the winter, viruses have an advantage because of the climate that allows them to replicate faster, as well as the fact that we socially gather and we cluster together. Historically, viruses thrive during this time. As we move into the winter, this is a great concern for us as we move forward that we're going to have an increase in the number of COVID as well as possibly influenza cases. Some of this can definitely be mitigated by the fact that we can do much better with regards to masks, social distancing, and good hand hygiene and avoiding our mass gatherings. We believe at Mosaic that if we do this, we'll likely be able to mitigate our numbers substantially, that we can lower our community rate, and thereby continue to serve you in the best manner possible. In a lot of the recent news, you've heard that Mosaic has increased their cases substantially. This is true. However, in 2008, we had the foresight to build a pandemic ward despite the fact that it wasn't needed. We have 48 beds of negative pressure, full pandemic floor available to us at the Mosaic facility in St. Joseph. In addition, we have additional 48 beds that we can use to turn into negative pressure rooms as well. We have adequate supplies in the form of ventilators, personal protective equipment, as well as room space available should the need for increased COVID patients arise. We're well equipped to withstand this pandemic as long as we get the assistance from the public in trying to mitigate or eliminate some of the cases that don't need to occur. This is predominantly going to be established by the fact that we need to make sure that we're wearing our masks, performing good hand hygiene, and keeping that social distancing and avoiding mass gatherings that is really required to help reduce the number of cases. At Mosaic, we've been able to achieve a mortality rate of less than 1%, which is far superior to those in the nation. We've been able to do this through the great efforts of our caregivers, predominantly our nurses, our respiratory therapists, and our technicians who help us to rotate patients and to take care of them on a daily basis. Here at Mosaic, we have state-of-the-art treatments in the form of convalescent plasma as well as remdesivir, and we provide state-of-the-art care in the form of our nursing, respiratory therapy, as well as our technicians. This is a critical aspect to taking care of COVID patients as they require much more care than a standard patient. Here at Mosaic, 90% of our patients are still non-COVID. Please do not delay your medical care in seeking out appropriate assistance when necessary, as we are here for you to take care of your needs. At Mosaic, we fully support a mandatory mask mandate for our service area and surrounding communities. We think this is the best way to help mitigate some of the numbers of cases and to reduce our exposure and allow us to continue to provide great health care. In addition, masks and the mask mandate are probably the lowest tech, lowest cost, least invasive way to potentially keep America open. Together we can get through this pandemic. Mosaic is here for you, but we rely on you to help us by making sure that you wear your mask in public, that you perform good hand hygiene, and that we remain adequately socially distanced and avoid mass gatherings.